Emergency officials are in a 3-day workshop to learn how to offer specialized service during an emergency. For instance, oftentimes evacuees are placed in shelters, but those evacuees' needs may differ from each other, and shelters may not be equipped to meet those needs.
NEMO has always conducted their, treated everyone as a whole. We're now trying to get to the point where we can look at the specific needs of different groups. So the elderly, like I said, they have people in who are handicapped and they need special care. So now with this kind of training, if there's ever an emergency in shelters, we'll know how to best treat them, how to deal with them on that particular level. In an emergency, people rush off and then they forget things. They don't have enough Pampers, they don't have enough milk for their children. Some of the shelters, we actually have to go on and create wheelchair accessible, make them wheelchair accessible. There's always how do we move people from one place to the next who can't move by themselves, people who are bedridden, that kind of thing. So those are the kind of considerations that we're taking through this workshop to see what steps we can put in place to make that easier.
This training is being done in conjunction with the United Nations Emergency Task Team, UNET. UNET will assist to build capacity in a number of areas, including gender. UNICEF country rep Susan Cassette shares how the topic of gender was covered when planning for emergencies.
First and most important step that we talked about as for us to integrate in our work is understanding the way that people identify, and based on that understanding, inquiring further to understand what then they would need in the way of information, services and support to stay safe and to have their needs met in emergency. That's true regardless of how you identify, and so by coming away with that appreciation, the team is therefore going to be more sensitive to the need first and foremost to ask and to inquire and to actively find out how do different people identify, what does that mean in terms of the risks that they may face and therefore the support that they may need. It may be different for a male, it may be different for a female, it may be different for a person who doesn't identify as either, whether in terms of reproductive health support needs or whether in terms of psychosocial support needs or access to various services. So we definitely talked about it as the first step, not specific to any one population, but as a first step to help us lead into more helpful ways of planning and preparing for supporting people regardless of their gender.
The Ministry of Local Government is also participating in the workshop. Acting Director Clifford King shares how the ministry supports the municipalities in emergency preparedness.
We've been working very closely with UNICEF over the last 5 years or so, in particular as it has to do with the implementation of the Sustainable and Child-Friendly Municipality Initiative that is ongoing. And more recently, in collaboration with NEMO, we recognize that there is a need for more training and capacity building in terms of emergency management and our response as a nation to disaster and the issues surrounding disaster risk management and risk reduction.
Reporting for News 5, I'm Andrea Polanco.